angle surgeries, so I do eye stents and trabectome, and I've recently started using the Kahook Blade in the last 6 months or so, and I've been really pleased with both the application of the technology as well as my results so far.
We have been having very good results. We have about 30 patients that had Kahook Dual Blade surgery.
We've been using Kahook Blade now for the last 6 months, so the data is still not out there, but I had good results so far.
The KDB Blade is a very useful addition. It's something that doesn't have a huge learning curve and does provide good efficacy, and I think with minimal complications.
They are doing pretty well. They are under control. The IOP is in the low teens with 1 or no medications. So we are happy with the results.
I use minimally invasive procedures, and I came here today to learn a little bit more about the Kahook knife, so because I want to start using it. We set up a wet lab in our institution, and we're training the residents in addition to the doctors to start using it, and today was very important to see some of the data.
And I'm excited to try the Kahook Blade and compare my results between these two very useful angle surgeries.
The Kahook Dual Blade is definitely gaining acceptance rapidly. I think as more and more users start to use the blade day to day in their practice, and we start sharing experiences, which has largely been positive so far.
No matter how wonderful a solution is, if our patients can't afford it, then we can't use it. So we're excited that there are new approaches being undertaken. We've had some very good results so far. I'm excited to see additional data. We'll continue to collect data, but this is the right direction to be going.
On the other hand, my experience with the angle closure patients is beyond my expectations. It's kind of like takes away two components of angle closure. One is where the iris is stuck to the trabecular meshwork, there where you do a gonioscopic analysis, and the next step is you go inside the trabecular meshwork and open it up. So in a way, so far, like in the last 6 months of data that we have seen, it's been very good.
I think this is something that will be very attractive to not only glaucoma specialists, but also to comprehensive ophthalmologists and cataract surgeons as well. This is something that should really help us in our clinical care of patients.
And because the Kahook Dual Blade adds another armamentarium for me, taking care of patients chronically who are 80, 90 years old, and I want to be able to provide pressure lowering while at the same time minimize the side effects on the patient. So yeah, I'm looking forward to using it.
I'm so excited they are introducing the canal surgery, i.e. the Kahook Blade. It's one of the easiest glaucoma surgical techniques that have been introduced into the glaucoma world in the recent past. So yes, definitely I would recommend highly this meeting.
And I think other surgeons see that positive experience and want to join in to try and achieve those same good outcomes that others have had so far.
And I've been using this on all kind of patients, like mild to moderate open angle glaucoma patients. And in a way, I'm lucky to use it on angle closure patients and some acute angle closure patients who pressures were like in 50s, 60s. So far, my experience using this in mild to moderate open angle glaucoma patients have been so great. Since last 9 months, we have the data that it's proven to be very safe and efficient.
So it's going to add that simplicity in patients with mild glaucoma when we are combining glaucoma surgery with cataract. And also I'm trying to use Kahook in patients with failed trabeculectomies and failed valves where the angle is still open, or in narrow angles as has been pointed out. So I think the indications for Kahook Blade are going to only expand as time goes on.
In our current arena of trying to help glaucoma patients, we have to look at efficacy, safety, but an important factor is cost. And the KDB Blade is addressing that issue. It's offering an opportunity to help patients with a MIGS type procedure, a minimally invasive procedure, but the cost basis is considerably less.